All right, guys, welcome back to the Adventure PT podcast brought to you by Dr. Nick Anderson, PT DPT with Pinpoint Physical Therapy. Our guest today is Dr. Joanna, a chiropractor in the Cleveland area, also does some dry needling, some acupuncture, very experienced runner as well. So we're going to get into a lot of that. Joanna, how are you today?
I am great. It is 60 degrees today in Cleveland, Ohio, so I cannot complain. Haven't had that in a while,
Yeah,
so it's
we
feeling pretty
we got to
good.
take these days while we can. It's this fall spring, it's going to get
Yeah,
cold again, but
yeah, for sure.
we got to take it. So you are a chiropractor by trade,
Yes,
a runner as well,
yes,
and you do some acupuncture and some dry needling.
yep.
So tell me about your practice, where you're located, and what you're all about in your mission.
Cool. Yeah, I own Modern Motion Chiropractic. We are located in North Royalton, Ohio. So if you're kind of familiar, we're basically southwest of Cleveland, like city proper. I grew up here. So I left a little bit for college and now I'm back and it's great. Not
Awesome.
much has changed. But yeah, I'm a chiropractor by trade, but I also in my clinic do a lot of needling, acupuncture, and dry needling. So I graduated December of 2020, which is like the worst time ever to graduate because the world
Right.
was crazy. So right after school, I worked at a couple different types of clinics, just kind of seeing what I liked, what I didn't like, and ultimately that led me to start my own practice. So at Modern Motion, my main focus is to provide truly individualized and personalized care plans to people, specifically like more athletic based active people or runners, people with specific active goals. I go well beyond the standard just chiropractic adjustment. Yes, that's a huge part of my practice, but I also incorporate, like I mentioned, a lot of dry needling, acupuncture, soft tissue modalities. I never wanted to be the chiropractor that just focused on one thing. So
Right.
that led me to start my own office where I can incorporate more, have longer visits, and really be one-on-one with my
Yeah, I love that. With PT, I would say private practice is, I would say, less common than
mhm.
chiropractors. I know a lot of chiropractors, and I don't know if you get any of the business side in school as far as education, but PT school, at least at Cleveland State, we got very minimal exposure to starting a business, how to run a business. Would you say that a lot of your colleagues from your class are in the private practice realm for chiropractor?
Yeah, chiropractic is very different. I mean, probably within the last maybe like 10 to 5 years, there has been more hospital-based chiropractic
Okay.
opportunities. It's pretty uncommon. Whether you're going to start your own or work for someone else out of school, you're going to most likely be in some type of privately owned clinic. And those can vary from huge franchise, high volume clinics to kind of the small mom and pop owned clinic. Most of us, like most chiropractors, there's going to be some type of entrepreneur business side of it. That being said, we really don't get that much training in school. We get a little bit, and I feel like nowadays there's a little bit more. It's hard though because there's so much we have to learn just on the medical and academic side.
Right.
We have similar training to medical doctors in terms of having to know how the body works, but also we have to learn the technique of the adjustment itself. So we're in a ton of classes. We don't have that much extra time. So trying to fit in where we learn the business is pretty slim. You kind of have to like seek the knowledge on your own. But yeah, it's tricky because most of our opportunities are going to be within private practice and we just kind of have to figure it out as we go.
Yeah, that's a good point. It's a lot of schooling for sure on both sides. I think it's so cool that physical therapy is finally at the doctorate level
Mhm.
where now we, have the prerequisites to open up private practices more. I think that should be more common for PT. I think the chiropractic model is ahead of PT in my opinion by 10, 20 years. I think as we go the next decade, with how health insurance is going, we'll see more private pay or just private PT in general in gyms in smaller settings, solo or a couple of PTs at most. But yeah, very cool. With the modalities you mentioned, how do you see that preventative, like maintenance type of care with my patients? I'll get runners in or kayakers that, they pop in every so often. I have some pretty high level, training pros in different sports, and they're just beating themselves up, and they pop in for, that maintenance work, the cupping, the scraping, dry needling. Where do you see that fitting into your model of treatment?
Yeah, I would say, again, every practice is a little bit different. My practice is more maintenance focused versus like acute care. I mean, I do obviously get patients who limp in here, but majority of what I try to preach is come in before it's a problem. So when we look at like someone training for a marathon, I want them to come in at the start of training. We need to be addressing those imbalances and that tightness in the muscles while your mileage is increasing. I don't want you to come in 2 weeks before the marathon with a shin splint,
Yeah.
and then we're like super limited in what we can do. So what I always tell people, I'm like, preventative care is going to save you time and money later on.
Yes.
You're going to come way less frequent. You're going to spend way less money if you come, at the beginning of that training cycle versus those last couple weeks. Now we're kind of in like an SOS. I got to see you way more frequently, do way more. So if like especially with athletes, your body is taking on an increased stress. Even if you're not feeling the pain, it's there. Like the pain is the last thing you're going to feel and see. So you have to take care of it before it gets to that point. Once you get to the pain, sometimes it might be a little too late to really be able to
Right.
make a huge change before that
Right.
competition or race. So that's a lot of what I do is working with active people who have these goals. They want to stay in their sport or their activity for as long as possible, and they don't want any setbacks. So they're going to come to me as soon as they start taking that Pilates class because they don't want to miss a week of it later down on the line.
Right. Yeah. Putting out the small fires before they get too big.
Absolutely.
That's a lot of overlap with my model as well. Get ahead of the game. It's going to save you time. It's going to save you money. I think preventative care as a whole is gaining more traction, I think, in this country, especially with, like you're saying, the very dedicated athletes, like runners, the endurance community, it just as a whole. They love to do what they are doing. Most don't ever want to stop, as long as they can physically do it. And I think it is gaining popularity in mainstream. You see some of the bigger podcasts talking, Joe Rogan and Huberman and some of the big guys talking about the importance of everything we're talking about and sauna and
Right.
all those modalities for sure.
Pain is so subjective too. Like it's hard as a clinician to base everything just on how much pain you're feeling.
Right.
So I always try to take a more like objective approach. I'm looking at how you're moving. I'm, looking at the strength of certain muscles and, the pain really doesn't mean a ton to me. It's like, great, you don't have pain, but this is still off. Or you're in a ton of pain, but this is moving better. It's a really hard way to truly track your progress. It's not a good metric to use in terms of my side, but even you as a patient, that shouldn't be your only metric is if you're in pain or not.
Right. And I even almost try to steer away from those pain conversations with patients. Try not to fixate on that. I've done some education from Dr. Joe Tata. If you've ever seen his pain science work, he's a pretty cool guy on social media. And like you're saying, focus on what can you do? What are maybe the functional deficits right now versus the pain levels, fixating on that. As you said, it's very subjective. Pain can vary up and down for 1,000 different reasons, hard to control all the variables.
Yeah, exactly. And if you're marathon training, like I expect you to have some pain. Like that
Right.
doesn't always mean injury. Like, yeah, if you just did a 20 miler, I expect Monday for you to be feeling a little rough. So
Yeah.
It's just really not a great gauge of your true health or fitness.
For sure. With some of these modalities, we've talked about dry needling and acupuncture. So I dry needle, I do not acupuncture. And almost every one of my patients that is new to dry needling asks me, what's the difference between this and acupuncture? And I can give them my side of things because I'm educated in dry needling, not on the acupuncturist side. Since you do both, can you educate myself and anyone listening? What are the differences between the two, and when might you choose one over the other?
Yeah, so to give you a background on like the my acupuncture education. So my acupuncture training was somewhat separate from my chiropractic training. Now my chiropractic degree is what gave me the ability to do the acupuncture training. So every state is different. In Ohio, you primarily do need either a doctor of chiropractic degree, physical therapy, medical doctor, all that, or you can go to acupuncture school and be an acupuncturist. But even at just an acupuncturist alone doesn't give you the full practice scope that having some type of medical degree. For Ohio, now this has changed a bit. When I was going through it, I had to have 300 hours of continuing education. Now it's 200 hours. I have an extra 100 hours for whatever that's worth. And then you have to take a state board exam. So I had to take 4 board exams for my chiropractic degree, and then I had to take another one for my acupuncture degree. So it's a pretty extensive training. And where that kind of differs with dry needling is dry needling typically in the state of Ohio is like just a weekend seminar. So in terms of education, it's way easier to get a dry needling degree. Now with dry needling, you also do have to be a chiropractor, a PT, medical doctor, or an athletic trainer. So there's still, I mean, you can't just walk in and take a seminar. Now, acupuncture as a whole is like this huge umbrella in terms of different needling techniques. There's a lot of different sections under the acupuncture term, but primarily when you think of acupuncture, you're thinking of the meridian system. You'll hear people talk about the chi and the meridian and, a point on your hand that helps your stomach. So with acupuncture, you can really treat a wide scope of things from internal disorders, mental disorders, and then you also have your musculoskeletal care in that umbrella. We call that ashi points. You'll hear people talk about. That's trigger point therapy. So dry needling is basically that category of it. So they took kind of the ashi musculoskeletal and they kind of took it out and made it dry needling, which is great. A lot of acupuncturists get so upset over this topic. But because we've done that, we've allowed more access to these needling techniques. Now, more doctors are able to do it. Patients have better access because it doesn't take as much training as acupuncture. But you're limited. With dry needling, you're going to be focusing on mainly just musculoskeletal health. So trigger points, that kind of stuff, muscles, tendons, ligaments. Acupuncture is where I can dive into stomach disorders, hormone imbalances, really encompass everything. The biggest thing you're going to see treatment-wise is if I'm doing traditional acupuncture points, they can be all over the body. So I could be treating your knee and have points in your hands and your wrists, but I'll also do points around the knee. Whereas dry needling, you're going to see it more focused on that area. If you're coming in for a knee complaint, you're going to see just those needles around the knee. You're not going to see the hand points that I'm going to use. It's really it's not that different in terms of the actual treatment itself, other than I might use more points with acupuncture, but
It's the same needles. We're using
same
the same
needles.
needles.
Same needles. Acupuncture, I might leave the needles in longer. Typically, I'll leave those in for 20 minutes, whereas dry needling, maybe I'll just do some pistoning just to get a couple spasms, or maybe 10 minutes. It tends to be a little bit quicker. But really, it's just dry needling is like a section within acupuncture itself. It's just focused on a different area than acupuncture.
Yeah, that makes sense. And there's a lot of overlap for sure.
Yeah, a ton of overlap. And a lot of it is just legal jargon, you can't say you're doing acupuncture,
Right.
that's really it. You technically could be. So, I mean, just to kind of out myself, when I was still getting my acupuncture training completed, I was certified in dry needling. So I was still in the clinic doing needling, but I couldn't call it acupuncture yet. So it's like I'm still kind of doing it. I just have to label it as this one thing for, certification purposes.
Right. Yeah, I think with needling, I did my education through integrative dry needling.
Me
And
too.
is that who you did? Yeah. And it's cool with the localized spots like you're saying, but then there's also that nervous system component where you do
Absolutely.
get, you can follow the peripheral nerve tracks down. That's how I explain it to my patients. I'm like, the acupuncture is based on the meridian system,
Hmm.
whereas the dry needling is based on peripheral nerve tracks and trigger points. Certainly there's I'm sure, points that overlap in each ideology. But yeah, the nervous system tuning component's pretty cool. I almost describe it, patients that have never had it, it's, if you ever get like a really deep massage and you just feel a little groggy and
Yeah.
relaxed after, it's similar sensation to that.
Yeah, the in the meridian system, it's so tricky because traditional Chinese acupuncture was written in traditional Chinese language, so it's been translated through centuries in different languages, so there's so much mistranslation. So I always explain when people are like, what is a meridian? A meridian by definition is just a channel in which energy flows. Now, in terms of Western medicine, what is that channel? A nerve, electrical energy, a vein, an artery where you get the blood flowing, even fascial lines, muscle, tendons, where you're getting some of that mechanical energy. All those things are what the meridian is. And then what is the chi? Chi is just considered the energy. So that can be electrical energy from the nerves, mechanical energy from how the muscle is moving. All these kind of made up lingo do trace back to scientific language if you just take the time to really dive into it. And the meridian system it's neural pathways is essentially what it's looking at. And the reason that it's so kind of funky is because it's based actually on embryological development. So if you really want to dive into that, which I don't want to, but the way that we develop in different muscle groups and organs, it's like we started in this clump and then layer by layer we developed. And that's essentially how those neural pathways developed. So that's why a point in your hand can go to your liver. It's not as straightforward as just looking at the body because it actually stems back from when we were truly a clump of cells. When I took the integrative dry needling as well, it was so interesting because all the points that we looked at were all major acupuncture points. Whereas they label it by the nerve or, the muscle. All of those, I'm like, oh, that's stomach 30, that's,
Yeah.
large intestine 4. I kind of joked with the instructor because he was very anti-acupuncture and he told me it was all made up. And after the course, I said, yeah, but all the points you taught were acupuncture points. So there is so much overlap between the two.
Yes, for sure. And, acupuncture is a much older modality, right? It's like thousands of years been,
Right.
and very effective science over thousands of years, or people would simply not do it anymore if it wasn't effective. I mean, that's my argument.
Yeah.
Every passive modality, dry needling, acupuncture, cupping, what have you, the research is very mixed on it, right? It's not a one size fit all approach. If you're inactive and have chronic issues and you're looking for a quick fix, I'm pretty honest. I'm like, it may help acutely, but this is going to involve a much bigger lifestyle change, mobility, exercise change. So that being said, it's a one-off treatment. With the active people, it's great. The modalities we're talking about, very effective for runners, for weightlifters. Those that are just getting a little beat up, I say just a little overuse stuff, you need a little tune up, get a little massage work, get some dry needling, get some scraping.
Right, exactly. I mean, there's always more to it. Like there's so much debate versus passive modalities and active modalities. There's a place for both, like you can't solely rely on just your weekly adjustment to fix your whole health. If you're not moving, there's only so much I can do. But I do think that there is a ton of benefit in passive modalities as well. But at the end of the day, your lifestyle is probably going to be obviously the biggest factor in your health. Obvious, but I still have to remind people that every single day.
Right. Yeah, it can be easier said than done for sure.
Right.
With PT and with chiro, at least the last few years, I've really tried to surround myself with colleagues that are new school, evidence based, modern, whatever you want to call it. Obviously, modern's in your business name.
Yeah.
And there's a lot of bad PTs out there. There's a lot of bad chiropractors out there. There's a lot of bad anyone in any field. I know a few myths with like old school PT is you can't squat with your knees going over your toes, or the yellow TheraBand rotation for every shoulder issue. With chiropractors, if you unfair, fair, miss, whatever you want to say, realigning, putting a bone back in place, or getting your back popped and then just leaving the office, for a 6-minute visit.
Mhm.
What would you say, if I'm playing devil's advocate,
Sure.
what would you say the modern chiropractor, what your treatment methods would look like and why? And then I'll go through my side from the PT side.
Yeah, I think it's really interesting to bring up the bone out of place model because I do have to say I feel like most chiropractors at this point understand that we are not putting bones in place, okay? If you look at the science of what an adjustment does, that joint is moving at most 2 millimeters. It's
Yeah,
usually like
tiny.
0.5 to 2 millimeters, which
Right.
is not a lot.
Yeah, yeah.
Why do people still use the term, bone out of place? Is because I just think they don't want to adapt their vocabulary. Like, I think they know what they're doing, they just don't want to change it. I will catch myself a lot of times. I don't like to use the word alignment, like I'm fixing your alignment, because I'm not doing that. I tend to use more like dynamic terms like restricted joint motion or movement based terminology versus like,
Right.
oh, your vertebra is twisted. And I think most of us understand that. Just some old school people don't want to change the way they're talking. They've been doing it for 30 years. It's hard for them to on the
Yeah,
spot change that. So
sure.
I will give credit to the older docs I know. I do think they understand it.
Yeah.
They just, can't teach
It's
an
a
old
pattern
dog
at
new
this
tricks.
point. Yeah.
The modern chiropractic office, it's so dependent, but I would say where we're developing as a profession, at least for the newer people out of school, want longer treatment times, okay? The whole conveyor belt system, 5 minute, crack, move on, we're hopefully starting to move away from. Now, there are still a ton of clinics out there like that. I have worked in them myself. Those tend to be big money makers, so they'll always be there. But in terms of someone who's going to consider themselves an evidence-based modern chiropractor, they're going to be spending, 30 minutes, an hour, maybe for maintenance, you'll see like 15 to 20 minutes, depending on what they're working on. They're going to be incorporating more than one modality, okay? So for me, I don't have a large gym in my office quite yet. So I do give some exercises, but more at home stuff. Or if it's someone who really, really needs like true strengthening, I'm going to refer them to a PT and I'll just handle some of their like passive care stuff. But you're going to be seeing whether they're using exercise, whether they're using needling, whether they're using ART, like it's more than just the adjustment. The adjustment is great. That's kind of where I start. But I think we understand that there's more to it than just moving that joint.
Right. It's really good business model. Come in four days a week and get your neck and back adjusted and leave. As you know, those grade fives, they feel great. They feel really good.
You feel great until you're 6 months in and you're tired of coming 3 times a week
You're right.
and you only
Right.
feel, 10% better. Yeah.
Yeah.
Then you're like, oh, okay, I get it now.
Yeah. Really good business model, though, for sure. On the business side of things, just keep people coming back in. I would say for PTs, I think language is huge, like you're saying. Trying to steer away from fear-based language, trying to use positive reinforcement, not underselling an injury. If it's a serious issue, I'll be serious about it. But in our healthcare system, there's so much catastrophization that goes on just from incorrect and poor language choices that stem from every level of healthcare up to surgeons and physicians and down to techs and aides. I think modern PTs are realizing that, especially that we're dealing with people that are generally in pain, and how you talk to them and how you explain and educate them on their issue is huge with how they perceive. Now, if you want to call it a placebo effect, it's fine, but the brain's super powerful. And if someone can change their perspective on how this injury, how they feel about it, how, their emotions and mentality about it, that alone can be one of the most useful things that we can provide these patients. And giving them, that prognosis of timeline, like, yay, this can get better. It's not going to be easy. Potentially, it's going to be a grind, but here's the plan. If you stick with it, then we'll see what happens. And we've seen patients get better with X, Y, and Z with this kind of plan. So I think modern PTs as well. We're trying not to underload. That's the yellow TheraBand.
Yeah.
external rotation. PT is cool because you can really, really niche down. Same with chiropractics, where there's PTs that only work with overhead athletes and throwers. There are some that work with pediatrics. They work with kids with, balance issues or developmental disorders. You can get into, just geriatrics, working on vestibular, working on balance. So it's really cool that, as time goes, I'm seeing a lot of my colleagues start to really niche down into more specific areas. So I think one of the areas though that I'm passionate about is not underloading patients. I mean, I see such a waste of time so often throughout the years of being a PT with patients just doing stuff way too easy. No
Right.
RPE scale used. It's just winging it. And a lot of that is just the system in general. It's hard to, you just got to see 15 people a day. You just got to keep the day moving. So
Right. It's hard. Those old models, like we said, they're there for a reason. They made money, so that's what they
yes,
were developed. Um, but the fear mongering that's huge. That's
yes,
huge in chiropractic. Like the crazy stuff I've seen, you wouldn't believe. But I think with the modern chiropractor, and I know in my practice, I really want my patients to understand if I'm telling you something, I'm not telling it for my financial gain. My doctor hat is first. Like I'm a business person. I own a business, but when I'm speaking to you, my recommendation is coming from my medical degree, not
sure,
my business.
sure.
So I don't x-ray every single person. I
Hmm.
don't have an x-ray in my office, but there are sometimes, I had a patient this week that I said, I want to get an x-ray. Like I want to see what this looks like. And, sometimes, the traditional chiropractor, we overused imaging like crazy, where we'd pull up a spine and say, oh my God, you have the spine of an 8-year-old. No, that's
Yeah,
ridiculous. Arthritis really doesn't mean that much, especially if you're over the age of 50. There's going to
yeah,
be some arthritis.
yeah.
So just making sure, yeah, the communication is huge. Like maybe the treatment itself isn't that different. I might be doing the same adjustment that someone else is, but
Right.
my communication is what is the big difference between the two.
Yeah, I totally agree. That's interesting with the imaging because there's been so much, and I get that too. I want to go get an MRI. Like, okay, you can if you
It's not
want,
going to tell us anything. You're not going to
but
change
with
it.
there's been so much good, peer-reviewed research that shows that imaging does not correlate to pain. Again, pain is multifactorial, man. There's so much that
Mhm.
goes into it, more than just the imaging.
Right. I learned that the hard way when I injured my back about 2 years ago. I mean, I was in a ton of pain, a ton of nerve pain. I didn't have any weakness or anything, which is kind of the big thing when we're looking at, a disc herniation, whether or not or MRI. But I ordered an MRI for myself, and my disc herniation was so minimal. It was like I literally had a surgeon even kind of laugh, which, if a surgeon's laughing, then it's minimal. But
Right.
I was in a ton of pain for a very long time.
Yeah. Oh, yeah.
So it really doesn't have anything to do with it. And like, was my pain worse because now I know that there's my disc sticking out? And am I thinking about it every time I'm moving subconsciously? And that's why everything hurts? So when first and foremost, I'm doing an exam. Before I recommend any type of imaging, examine trial of care. There's some scenarios where, yes, right away I'm like, let's get this image. But most of the time, if you read what the literature is saying, examination, 4 to 6 week trial of care, and then you can determine if you want the imaging or not. It is
Right.
like, should never be the first thing you do.
Right.
And medical doctors make that mistake too. It's not even
Oh,
just
yeah.
chiropractors. I see that
Right.
all the time. So I don't know. I don't know what the deal is with that. I don't know if we panic and just want to get an image to cover ourselves, or if there's a financial gain to it. Who knows?
Right.
It definitely more harm than good sometimes.
Yeah, and we're good. We're educated highly enough where if there's a red flag, yellow flag, like I'll tell my patients, I don't think you need an MRI. If you
Hmm.
want to go get one, fine. Also, if you're getting to a point where I feel like you need one, I'll let you know. Or if
For
you meet
sure.
the criteria to get an X-ray, like I'll let you know. If it's an ankle or whatever, the fracture rules, like gonna be honest, like yes, go get an X-ray. You gotta leave. You gotta go. So definitely, there's a time and place for it, but definitely overutilized.
Hmm.
What's on your docket this year for running? Any races on the schedule?
Um, we'll see. A little bit about my running is I've run 9 marathons, 9 full marathons. I started
Awesome.
running when I was an undergrad and just kind of went crazy from there. 2021, I was going after a sub 3 hour marathon, and I finished in 3 hours and 8 seconds. And that was the most like demoralizing moment of my life. And as silly as it was, I really think it took quite an emotional toll on me because I was just burnt out after that. I mean, I didn't want to do anything. And with that mental burnout actually came quite a bit of injuries too when we talk about, pain and the mental side of it. So injured my back about 2 years ago, and I really feel like I'm just now starting to physically and mentally get back into it. I've ran some races since then, but nothing super impressive. So this spring, again, just trying to get back into it. Like I really want to do a half marathon, and I potentially may do a marathon in May, the Bayshore Marathon in Michigan. I impulsively signed up because it was 90% sold out. So I signed
Yeah.
up. I'm not even fully committed to it yet, but I'm just trying to get more consistent with my running. Unfortunately, this winter has been terrible, but so I mean, I would love to break 3 hours. It sucks being so close, but it happened. It's a great learning experience for me to feel that type of disappointment. I needed to be humbled a little bit, but it seems so far away. Like it's a barrier I didn't think was going to be as hard, and I've learned it is very hard to break 3 hours.
What is that pace on average for a 3 hour pace,
I want
like
to
per
say it's
mile?
probably about like a 650. So I think when I
Jeez
was,
Louise.
yeah, yeah, it's cooking. I think I finished my pace came about to like 654, I think was what my 3 hour and 8 seconds. It sucks because it could have been the difference of a water station too
Yeah, eight
slow or a
seconds. I know.
slow turn, but
Well,
it
that gives you
happens.
something to chase still, you know?
It's there to chase, like is it's tough, marathons are no joke, and they'll make you feel amazing, but they'll also like crush your soul at the same time. So
Yes.
definitely physical, don't get me wrong, but the mental side of the marathon is way beyond I think people who haven't done it understand.
Yeah, I have not done a full marathon yet. I've done one half marathon so far with peer pressure from some patients and some friends.
How did that go?
It was good. I finished with no injuries, so it was fine. I wasn't cooking. I just wanted to get done and enjoy it for the first one. But I'm a soccer player by trade, just growing up, so like my cardiovascular base is pretty good. I've always liked to run. I would generally just do like 5Ks just for fun, just around the neighborhood and whatnot. But yeah, like being there in race day and having 3 month training cycle and being consistent with that, trying to eat better and drink less and then showing up on race day. It was a cool energy, man. It was really cool. So
Yeah.
now I'm hooked. You guys got me. I'm a runner now. I'm hoping
Mhm.
to do another half in the fall. I'm rehabbing a knee injury from
Mm.
soccer league, so I'm not quite there. I'm starting to walk and bike a little bit, get my base back, but yeah, hopefully do another half, maybe where we met, the river run, maybe, or
Oh,
the
yeah, that's a good one.
maybe the tow path again. That's the one I did. So
Yeah, yeah, I've
fun
done the
stuff.
river run many times. I did it this past year. That's where we saw each other. But yeah, it's the energy's great. I mean, I've had friends come to my marathons who are not runners who've been like, "Oh my God, that's
Yeah,
incredible." So it's worth. I mean, hey, if there's a local marathon, you don't have to run it, but like go see it. Like
go
it
check
will
it out. Yeah,
truly
for sure.
inspire you. And when I started running, I really feel like it changed my whole life. Like it made me a harder working person. It made me more organized. It made me more motivated. It's like when I started running, I started to see school wise, I started improving. Socially, I started improving. Like it really does change your whole aspect of how you go through your day to day. So I think it's cool.
Yeah, yeah. I mean, you repeatedly do hard things, and it makes the hard things easier to do. I mean, it sounds simple, but it's it's easier said than done.
Yeah, you have one hard, like my first marathon ever was terrible. It was Cleveland Marathon 2016.
Yeah.
If anybody was there, they'll know what I'm talking about. And me and my one running friend, no matter what was happening in life or in school, we would say, At least it's not as bad as Cleveland 2016. Like, I still hold that when I have hard moments where I'm like, okay, if I survived 18 miles in a hailstorm, like,
Oh my God.
I can get through this little presentation I got to do today. Like, it'll be okay.
It'll be
I'm
fine.
capable of more than I think.
Right. Right. Well, very cool. Good luck with getting back into training. We got a nice day today out for weather, but it's going to get cold again in Cleveland. Thanks for popping on. I hope, anyone that listens gets a good idea of the similarities of chiropractics and PTs and, what a treatment should look like. There's a lot of bad healthcare out there. So
Hmm.
if you're getting care that doesn't sound like what we're talking about, maybe reach out to one of us if you're in the Cleveland area,
Right.
or
Just
or we
other
can recommend
options.
someone that's good that might be a little closer to you. But Dr. Joanna,
Absolutely.
thank you very much. It's great chatting, and we'll see you soon. We'll see you around.
Yeah. Thank you for having me. Thanks for all the work you're doing in your clinic, and I appreciate it.
Yeah, absolutely. Bye.